Meredith, before we get started, we'll officially start in just a moment. But can you just, while we're waiting here for other people, um, can you just tell us how you got involved in this work to begin with?
Sure. Well, first of all, thank you so much for having me tonight. I'm always excited to talk about this. And I think it's both timely and timeless. So thanks to everybody who's coming in. And yeah, so I was one of those folks who always knew that I wanted to work with kids and families in some capacity since I was young, and at a certain point, really fell in love with psychology work in my undergraduate years. Right after school, I really thought I wanted to prioritize working with kids on the autism spectrum. And so I'm a
Yeah.
Baltimore native, and I
Yeah.
worked at the Kennedy Krieger Institute. For folks who might be aware, it's the children's hospital associated with Johns Hopkins. And I was doing primarily work with kids with neurodevelopmental disorders who had pediatric feeding issues, and did that work for a little bit. And one of the things that I learned during that work was that there was a subsection of kids whose feeding issues were primarily around anxiety. And those were the kids who I really connected with, and I wanted to learn more. So I moved to Boston in 2009, having never been, and which just is wild for my daughter and my Boston-based husband, who, just that I had never set foot up in New England. I mean, that's not true. I'd spent time in like Vermont, but not Massachusetts and not Boston. And so I um, did my master's program, and, got some research experience in anxiety, and then started my PhD program, really specializing in anxiety disorders at Boston University, really having the good fortune to study with some really amazing leaders in the field who particularly prioritize the cognitive behavioral treatment of anxiety. And so then I prioritized that throughout my school work, and I did my internship and postdoctoral fellowship in Manhattan, studying at Columbia University Clinic for Anxiety and Related Disorders. And the more I started working, but the more I was working with kids with anxiety, the more I became aware of how, we have all these wonderful sources for kids, but the parents are a part of this too. And anxiety can be such a gut punch for the whole family. And
Yeah.
so increasingly, my interest delved into how can we support parents more. And then I became one. And so, now I feel really lucky to be able to have my feet in sort of both areas of working with children and adolescents, and also to be increasingly doing parent-based work, which is kind of consistent with how the field is going. We recognize that old model of like my kid is anxious and I'm going to plug them in with a therapist and they're going to come out fixed is just woefully inadequate. And so, really we can find by really empowering parents, we can make some really exceptional treatment gains for kids and give parents a lot of confidence. So that's my stump speech, and
There you
it's
go.
really where my passion is, and so I'm so glad to be able to talk about this tonight.
Well, Meredith, we had a little glitch that folks know about in terms of the Zoom link for this that has taken us a little bit of time to get people into the room. And I think we've still got folks coming in. But we'll get started with the actual program. For folks who are here, I thank you and I thank you for your patience. You are at Building Brave, a conversation about young people, anxiety, and resilience with Meredith Elkins, who is the co-program director of the McLean Anxiety Mastery Program at McLean Hospital. And she also teaches psychology in the psychiatry department at Harvard Medical School and has her own clinical practice. My name is Moira Kelly. I'm the president of Explo, and I am so glad that you're with us tonight. Um, Meredith, why don't we get started with what this anxiety mastery program? What is it?
Sure, sure. So MAMP, we love our acronyms in psychology. So the McLean Anxiety Mastery Program, or MAMP, We are a group-based intensive outpatient treatment for kids ages 6 to 19 with primary anxiety disorders and OCD. What does that mean?
Yeah.
That's a mouthful,
What is
I
that?
know. So we specialize in delivering cognitive behavioral therapy with an emphasis on exposure practices and exposure therapy. And this is the gold standard approach to the treatment of anxiety across the lifespan. And so that was traditionally developed to be delivered, once weekly in an individual therapy session. But what we do is we bring kids in and we deliver about a year's worth of outpatient therapy in a manner of weeks. So this is a great option for families who are, whose kids are struggling and you're really looking to kind of hit it out of the park and really focus on the anxiety and the OCD as a way to help resume normal functioning. So kids come to our program for 4 afternoons a week for a minimum of 4 weeks. The average length of stay is around 6 weeks, and we are an interdisciplinary team of specialists, of psychiatrists and psychologists like myself, who really have a specialty in exposure-based treatments for anxiety and OCD. So kids come in and they have, weekly group-based exposures 3 days a week, psychoeducation groups. We do parent support groups and psychoeducation groups. There are psychiatry consults, weekly family meetings. We really try to provide this wraparound service to provide this intensive treatment to get kids back to being kids. So that's what MAMP is, and we also offer some adjunctive services. We have a group treatment for kids who identify as LGBTQ, who also are struggling with anxiety and OCD. And we're about to launch a new college intensive program. So for kids who are either headed off to college or maybe they took a gap year or they're going to be trying to return to college after a tough first swing, we're going to be doing a 1 week intensive at the beginning of the summer to really give kids some anxiety management strategies. So we do a lot of different things, but the part that's kind of closest to my heart and what I really have been spearheading is education and support for families. Basically, how can we give parents everything that like a clinical child psychologist wants you to know about anxiety so that you can best support your kids? Or as one parent said, like at the very least, not make a tough situation worse. And I'm here for that too. So that's our work there. Yeah.
Here's my question for you. I mean, in a lot, I work with students in schools, and by no stretch of the imagination, and a clinician. But I find there's been a lot more recently, I'd say, in more recently, as opposed to when I began my career in education. That there's pathologizing of the notion of anxiety. Like there's something, it in a little bit was like, yeah, being out in the world is an anxious kind of thing to be. So,
Yeah.
you're working with um parents, or you're working with educators. Where's the line between, I would say, normal anxiety that everyone has, and then it moves over into something else? Where is that line?
That's a great question. And frankly, I think the English language doesn't do us any favors with this because, we have a distinction between sadness and depression, right? Or trauma and post-traumatic stress disorder. But in our conversations, we talk about anxiety as both a normal feeling and as a clinical disorder. And so I think this really muddies the waters. And so more and more we hear folks being like, well, it's my anxiety. I have anxiety. And it's like, yes, you have anxiety. I have anxiety. We all have anxiety. And the term that you used of pathologizing this, I think is something that's become really this double-edged sword of both decreasing stigma around elevations and anxiety, but also over pathologizing sometimes this very normal, natural, and frankly helpful emotion. So where is the distinction between the two? When we talk about anxiety, we're often referring to our anxious thoughts and our anxious feelings. Those are the things that seem to cause us a lot of distress. But as clinicians, particularly as cognitive behavioral clinicians, what we're really looking at is the behavior. What is the anxiety driving you to do or not to do in a way that's getting in the way of your life? So, for example, if I'm a kid and I'm so anxious that I'm going to, I'm going to panic and I'm going to vomit, that I stop eating, right? And then I end up in the hospital. Or I am so overwhelmed with kind of thoughts that I need to be perfect and my schoolwork needs to be perfect and I need to just be killing it on the lacrosse field, that I'm not able to sleep. I'm not able to enjoy myself. I'm not able to engage with my friends, right? So when that the behaviors start interfering with what I need to do. So I think the number one thing that we're looking for as clinicians when we're doing a diagnostic assessment is the interference of the anxious behaviors. Um, because the sort of tricky thing is and then people often don't believe me with this one, but that the anxious feelings, they can't actually hurt you. The anxious thoughts, they can't actually hurt you. What you do with those anxious thoughts and feelings, or because of those anxious thoughts and feelings, that's where the challenge comes from. And what we find is that if we can help shift our behaviors in response to anxiety, then we start to see symptom relief. So that was a long-winded way of answering your question, but really, if you're an educator or you're a parent, we're looking for the interference in how much is anxiety getting in the way in the day-to-day.
So, kind of as a follow-up question to that, does an anxiety disorder look different depending on the age groups? If I'm dealing with a 5-year-old versus someone who might be 12 or 15, are there some commonalities there or it manifests differently?
That's a great question. And I think, development, kids' developmental age has a lot to do with this. Um, and so we're more likely to see some anxiety disorders in younger kids as opposed to older kids. So for example, we're more likely to see separation anxiety in school age kids or young, even kids who are younger than we are in older kids. That's not to say that it can't exist in older kids. In fact, there's separation anxiety disorder that's been identified in adults as well. A lot of it has to do with brain development and what's typical in terms of brain development across childhood. So, for example, when kids get to be, school age, they're, 7, 8, 9, they start to kind of realize, oh my gosh, I'm actually starting to pay attention to the things that I hear, on the news when my parents are playing it, or I pick up on things that kids are talking about in school, and the world isn't Sesame Street. And so as they start to kind of have that realization, you start to see more generalized anxiety disorder. And so again, generalized anxiety disorder is these kind of what if kids, the kids who are worrying about
Oh,
everything
okay,
all the
yeah,
time, even if there's nothing to be worried
yeah.
about. And these are the kids who have a lot of physical complaints that go along with those worries. So headaches and stomach aches.
Yeah.
And it's just because, like, again, cool things are happening to their brain. And it's a double-edged sword, right? Because they're recognizing more of these things that can go on. And then we hit adolescence, right? And we hit puberty, and there's all sorts of hormones. And this is when we're more likely to see the emergence of panic disorder. So
Oh,
which is characterized by, panic attacks, which most people have had a panic attack at some point in their life, but panic disorder is actually repeated panic attacks and then the fear that you're going to have more panic attacks. So you
can
change your
I ask just because there might be somebody who has not had a panic attack or doesn't know what that looks like in a child or somebody. So what is that? What is a panic attack?
Great question. And this can go back to the difference between fear and anxiety, right? Which are actually two distinct emotions. So fear is like the red light of anxiety when you are in danger. This is your fight or flight response. So your heart rate is going to be beating out of control, or you feel like it's out of control. It's actually in control, but it feels like it's beating out of control. You have trouble breathing. You may feel dizzy, you may feel faint or lightheaded, be notice tingling in your fingers or in your face or in your extremities, having hot flashes or cold, like cold sweats. And you have these thoughts that maybe you're losing control or you're going to die. So it's the most intense experience of fear. And it is what would have kept our early ancestors alive, because in a real, actual threatening situation, the way that your nervous system, just jumps into high gear as you're panicking is actually really protective. It enables you to fight or flee.
Okay.
Versus anxiety, which is kind of like a yellow light to the red light of panic. And so that's kind of lower orders of muscle tension, worry, and maybe some nausea, maybe some stomach aches, but it's less of that acute, intense panic.
Okay.
Now, really important, you didn't ask this, but I'm going to throw it in there. Um, a
Throw
panic
them in, throw them in. That's good.
a
Okay.
panic attack can't actually hurt you. It feels like it can, and that's unless you have a pre-existing heart condition or a pre-existing medical condition, the a panic attack can't actually kill you. And so I think this is really, really important because obviously, as an adult, you see a child in your life, whether it's your own child or a child with whom you're working at in a school setting, having a florid panic attack. You want to do everything you can to help that child feel better. But, and so if you know that this is a panic attack, this is their body acting in the exact way that it should if they were actually in danger, but that this is not actually dangerous for them, they are not going to die, they are not going to have a heart attack. Um, you can just model so much calm and reassurance here and just be like, this feels awful. I know this is a panic attack. These things increase, they're going to peak, it is going to come back down. Your body wants to go back into homeostasis. And so, what we're modeling as the adults in our life to kind of normalize this is what's going on for a kid who's having a panic attack just pays dividends for how they're going to respond versus, oh my God, let me check your pulse. How are you doing? Can you breathe? Here's a bag you're going to breathe in. We need to go to the emergency room, right? It's going to create a different narrative.
Yeah. So I want to go back a little bit to the normalization on some level of anxiety, and I'm not talking anxiety disorder because I know that's problematic. But when you're talking with either parents, adults, educators, but even children themselves, what is the good role of anxiety? Because I'm imagining that there is a good role of anxiety.
Oh, absolutely. I mean, frankly, I probably, if I weren't like mildly anxious about speaking with you more, I probably wouldn't have showered earlier today, right? Or if you weren't like
I'm
having,
glad, Meredith, that you did
I
that.
know, and you're welcome, everybody. But again, like, or if you weren't worried about a test, you wouldn't study, or
Yeah.
if you weren't, like mildly cautious about your safety in public, you wouldn't look both ways before you cross the street. So there really is a role for anxiety, and it's an important role. Um, Usually when I work with people, whether it's, kids coming through MAMP or whether it's, women with perinatal mood and anxiety disorders in my private practice, and I say, what do you want out of this work? What are your goals for treatment? A lot of times the answer is, I want my anxiety to go away. And I'm like, well, you're not gonna be too happy with me, but we're not gonna do that. Actually, we're going to be learning how to cope with anxiety rather than trying to obliterate it. And I think the problem with the latter is that if we go through life feeling like we can only exist in a world that is curated to be anxiety free, we're never going to leave the house, right? So what we need to do is to focus on coping even with high levels of anxiety. And then paradoxically, what you see is that as that resilience and self-confidence grows, the anxiety then decreases. It's kind of a paradoxical way to think about it.
Yeah. Well, I mean, part of what I was thinking about too is I think because you and I have talked not just about anxiety, but other things in the past, is the notion of anxiety as a signal for something,
Mm.
and thinking about what is it signaling to you, and being able to think about I'm thinking about it, but also what is your body telling you about context and what's going on? Yeah. What, so what, I know it can be really difficult to watch your child struggle, and have a panic attack or just, melting down, not wanting to do things, whatever happens. But what is the role of productive struggle? Because you and I have both also talked about this, but if you are going to get to the point of building resilience with your child and confidence, that there's going to have to be some productive struggle that goes on. So, what is that, and how do you support it?
Yeah, productive struggle. I think I've heard it also termed as like the stoic challenge. Um, it's doing hard things. So this is actually the core of what, evidence-based treatments for anxiety are based on. It is, um, the recognition that when things are hard or when things feel scary or when things feel overwhelming, a very adaptive response in many cases is to try to avoid that thing, right? But if that thing is in line with your goals and values, for example, if it is AP history, and
Mhm.
yes, that is a hard thing, but it is in line with your goals and values to pursue your education at your highest level, then the challenge isn't just like let's make it so that it doesn't feel easy at all. Let's get comfortable being uncomfortable, right? So when I think about, a kind of a stoic challenge or sort of productive struggle, it's kind of like a bit like collecting data on your own ability to persevere. And so the way that, we do this with kids is starting by pointing out when they're doing it without even knowing. So you did something hard today and I noticed that. And what was that like for you?
Yeah,
How
yeah.
did you get through that? And so rather than giving them some sort of a lecture from, an elder millennial who they don't want to listen to about how your life will be better when you practice doing hard things, it's catching them doing it already,
Yeah, yeah, yeah.
bringing it out. And as a parent or as an educator, you can do this. You can point it out and be like, hey, I noticed that I was observing your interaction with so and so, and I realized they said something that was kind of that felt like that was kind of rough. And I noticed you rolled with that really well. How'd you do that? What was that like for you? How come you didn't just like scream at them and like run out of the room? And so again, they may just completely blow you off, and not respond. But the point is to kind of get the wheels turning and to help them to collect some sort of data that like, yeah, like I can do hard things, or I'm tougher than I thought I was, or I'm more capable. And so then what we really want to be doing is kind of creating a narrative, a resilience narrative of, okay, these are the times where things have been hard and I've still stepped up to the plate. Or maybe I thought something would be hard, and when I did step up to the plate, it was actually not as hard as I thought.
Mm.
And so I think framing success and growth as like you did something even though it was uncomfortable, rather than that was totally easy for you, no big deal,
Yeah.
is the difference here.
Okay. Okay. So sometimes, um, you may have a child, that, just, I don't know what I would call it, throws a tantrum, starts stomping their feet, refuses to do something. I just don't want, whatever it happens to be. And you have to make a decision as a parent about, are you still going to go into this, I'm making this up, dance class that I signed you up for, or not that I would know anything about that, or do I just say, oh, fine, we're not going to do, like, I want to say this is easy, but it strikes me that there's a piece of this that also, like, you have to have the courage to be brave in the face of this as a parent in dealing with a kid with this.
Yeah. I think that's such an important point, is that encouraging your child to do hard things, to face discomfort, inevitably means that you as a parent are going to have to tolerate some discomfort for, your kid's going to be upset, perhaps in public. um, they're going to be angry with you. And they really know how to kind of go for the gut punch, right? Like, because we know each other so well. That's how parent-child relationships work. So a lot of this is, how can we help parents to practice tolerating their own distress, and to kind of, cope with their own tough emotions, which is no easy task, as a, parent of an awesome little human who, you know, is full of all kinds of surprises. I know this intimately. A PhD doesn't prepare you for this. So, I think that I always want to encourage, there's no one size fits all, first and foremost, for how do you respond to a kid who's really, really upset around an anxiety provoking situation. Um, every kid is different, and for every family is going to have a different value set. So I always encourage families to go back to the values that you have and hold for yourself and for your kids. So, for example, I've signed you up for dance class. We show up to the front door and the kid balks and won't go in. What do we do around that one? Well, a couple things. If your kid is a kid who would always go into the dance class, who is probably just having an off day, and maybe you just call it and say, hey, we're going to try again next week, or maybe dance isn't for you, and maybe that's no big deal. The problem is that if you have a kid who trends anxious, right, who's maybe a little bit more introverted or a little bit more cautious about things, and you have the sense that trying something new, you're not necessarily surprised that they're a little anxious there. This is where anxiety can kind of hijack the equation, because we know that avoidance fuels anxiety. So allowing that child to skip out on this first dance class is going to provide relief in the moment for the child and for you.
Mhm.
And it's going
Yeah.
to teach the child, I only felt better because I left that class. I couldn't do it. And I'm not the type of kid who can do this hard thing. So if that's the situation that you intuit as a parent that you might be in based on your kid, then this is the chance to kind of move the needle a little bit. So how can you as a parent encourage do something so that anxiety doesn't win? So can you say you always want to start with validation, right? I see that you're really overwhelmed. It makes sense. This is new and this is different. And I know you can handle this.
Mhm.
Dance class goes for another 45 minutes. So we're going to stay. And whenever you're ready to go in, you can go right in. Maybe they go in, maybe they don't, but you've set a boundary about what you will do and what you won't do. And then it's kind of coping with the crying or the whining or the tantruming or the pouting and the stares of the parent peanut gallery and the teacher as you're dealing with it, right? Like, but you can handle that. That won't kill you. It just feels like it might in the moment, right?
It does.
And then setting the expectation that, we're going to try again next week and the next week and the next week until it gets easier to go in. But again, there's no one size fits all for them, but it's really thinking about, I know that if I permit total avoidance in this situation, I am reinforcing an anti-resilient narrative in my kid.
Mhm.
I don't want to let that happen. It's kind of like it's that like the vaccine metaphor where, when you take your little one to get their first shots in their chubby little thighs, you're not wanting them to be upset. You're doing something for them that is short-term pain because you know that it's going to help them be healthy, right? In the same way, setting a limit around how much space anxiety is allowed to take in your kid's life.
Yeah, that's so interesting the way you frame that, right? How much space are you going to allow anxiety to have in your child's life and putting boundaries around it somehow?
Well, it can become such a big thing in the family too, with anxiety, and, closely related to anxiety is OCD. We see families who are, completely held hostage to anxiety, right? Where it impacts what they can eat, when they can eat, who can be in the home, the types of activities that people do or don't do, whether or not parents have date nights anymore, whether they're sleeping without their kid in their bed, right? So it can, anxiety will take up more space.
Yep.
Um, but the good thing is that behavior is always modifiable. So if you as a parent sort of see something that you want to you that and you realize like anxiety is the unwelcome, third wheel here, then we can try to take steps to kind of to push back on that.
So, so here's a question I have for you. Parental anxiety. If I am a parent who suffers from my own anxiety, and perhaps have not figured out how to deal with that well myself, what impact does that have on my child? Is that a complicating factor in all of this? I hate to blame parents, about anything, right? And because on some level you have the child you have, and so many things impact how a child behaves. But can we contribute to this without knowing that we're contributing to a child's anxiety?
I think my discipline, psychology, psychiatry, we have a pretty shameful history of blaming parents. I mean, back in the,
Yeah.
1900s of blaming, autism on refrigerator mothers, right? Nobody wants to go there. What we know about the heritability of anxiety is that there's probably about a 30% genetic component. So a likelihood that, if you are a parent who struggles with an anxiety disorder, your child, just from their, what they come into the world with, they're likely to have more of a genetic vulnerability. Now, that doesn't mean that their story is written for them, right? Because again, so much of this is environmental, it is modifiable. So the way in which parent anxiety and child anxiety can be kind of stuck in this reflexive cycle is when sort of parent beliefs and behaviors around anxiety are transferred to or impact their kid.
Yeah.
So
Yeah.
if I'm a parent who believes that experiencing anxiety is harmful, like just the emotion of anxiety, not an anxiety disorder, but if I believe that, like, let's say strong negative emotions like anxiety or sadness or shame or anger, that any of these are harmful, and that when I notice my child is in any sort of emotional distress, I feel like it is my job as a parent to neutralize that, then
Okay.
and I act in a way where I do everything I can to neutralize it, that's communicating to the kid that each negative emotion is a crisis, right? That needs the full attention and support of the well-informed parental emotional police. And so
Yeah.
it creates again this narrative of I am not capable of managing my own big feelings. So that is one way where we see the sort of intergenerational transmission of anxiety that's largely driven by beliefs and behavior. So when this is something that if you're listening to this and you're like, table for two, that sounds like me. One of the things that I encourage you to do is sort of get curious about your own beliefs around anxiety. Like, what are you afraid will happen when your kid is anxious or when they have a big emotional response? And what do you think that your role is in that? And so, starting there and starting to actually, for parents to realize their own thoughts and feelings that come out around their child's anxiety is a really critical first step. And I love debunking some of these myths about anxiety because then it's like, okay, we can move forward here.
Yeah, I just think it's the framing around this as what are your beliefs around anxiety, right? And examining those, and the notion of the neutralizing of big feelings, and there's a gift in some ways of having big feelings. I mean, having them swamp you completely so you cannot make your way through the world is obviously a problem. But neutralizing things so a kid is deadened to them too on some level, I don't think it's a thing that we want our kids to have. You mentioned early on we were talking the notion I think of MAMP, where you folks do exposure therapy. Can you, for folks who are uninitiated in
Sure, sure.
exposure therapy, what is it?
Um, so exposure therapy, again, this is the approach to treating anxiety disorders, whether you're a little kid or whether you're an octogenarian, like this is the approach. Um, Exposure therapy is based on the understanding, and I alluded to this before, that when we avoid that we are driven to avoid things that we feel are unpleasant. This avoidance causes this short-term relief from whatever we've avoided, and that's so reinforcing, right? So we know that avoidance is the fuel for anxiety. Exposure turns this notion on its head by gradually and planfully encouraging the patient to, to expose themselves to kind of lean into the things that have been making them feel uncomfortable. And by doing that in a stepwise and gradual way, we do a couple of things. First, just as an example here, let's say we have a teen who's driving age. They're terrified to drive, right? How are we gonna help them with that? Well, it's not just like, let's just hope you're on a bus route for the rest of your life. We're gonna start small, right? We're gonna start by encouraging them to drive around the parking lot. What's likely to happen? So their feared outcomes are likely not going to materialize, right? They're probably not going to kill a pedestrian, or or hit a stop sign. And so that again like counters some of the negative thoughts and beliefs that we have, and it builds some confidence. We also see that even though I felt like so anxious while I was driving in that parking lot, I could tolerate that anxiety, and it sucked. And I
Yeah,
don't want to do it again, but I did it, which
yeah.
makes the next time you're driving in the parking lot easier. And so then you can kind of build from there. So exposure therapy helps you to practice tolerating your distress. It actually doesn't work if you're not anxious during an exposure. Um, and it helps to counter some of those assumptions that you have about what's going to happen. The coolest thing is sometimes your worst case scenario does happen, right? So for example, if we're working with a young person who's socially anxious, and we encourage them, we're like, you know what, we're gonna sort of lean into this exposure. We're gonna ask you to um, we're going to go into a Dunkin' Donuts and you're going to ask what type of pizza they have. And this might be if you're a kid who like really gets so overwhelmed when they inconvenience someone. And their worst case scenario might be that the employee is annoyed with them. Maybe that employee is annoyed with them, right? And they come back out and they're like, that was the worst. That was awful. Like they gave me this look and the people behind me gave me this look. And it's like, yeah, that's super uncomfortable. And you're still here. You survived. You lived to tell the tale, right? And so again, it's built about building data. You don't have to be in full-fledged cognitive behavioral therapy to start taking an exposure-based approach to life, right? Every time you send that email that you were that you were just like, oh, I don't want to do that. I really am procrastinating on it. That's an exposure. Anytime you like lean into something that feels hard or uncomfortable, that's an exposure. And when you do it and talk about it in front of your kids, you're modeling an exposure mindset. So that is a really quick and easy way to start getting the exposure narrative into the home, independent of any, formal psychological support.
Well, it's interesting because one of the things that that we'll talk about, at our summer program, but in schools is the notion that the likelihood that you're really going to learn more probably when you experience some level of discomfort. Because if
Oh
you're
yeah. Yeah.
completely comfortable, that means you're not getting stretched at all, and right, and so that if our work with kids is to stretch them, and hopefully at some point they stretch themselves, it's this, you are going to live in a period of discomfort, and that one of the things that I have heard college students and high school students, probably a little bit less younger because I'm not sure they always have the language, is sort of like, I can't be here because this environment produces anxiety for me. And it's actually you're uncomfortable coming
Mhm.
to this place and I understand that, but we need you to be here, right? Like we can't I one of the things that I worry about with us in confusing discomfort or pathologizing all anxiety, and again, understanding fully that things can move over to anxiety disorder, is that life is not comfortable. And that doesn't mean it's not good. And that we're making kids' lives smaller or our own lives smaller if we're just looking for comfort all of the time. And that if we're going to really approach the world in a little bit more of an explorer fashion, that means you don't quite know what's around the corner. But I've seen kids, I have to say, over the last 15 years, unfortunately become more risk averse, with concern that there is peril around every corner.
Mhm.
And it seems to me that this is kind of, there's some parallel with living virtually to some degree on a smartphone and social media, et cetera. But that is only a general observation. So I'd ask you about that because I think a lot of parents are kind of like, I don't know what to do with this. I have kids going, but everybody else has a phone or everybody else is on social media. Like, what do you do with this, given what's coming out now with Jonathan Haidt and others about this really isn't good?
Yeah. Well, I think that as tempting as it is to pin the absolute surge in child anxiety and depression on on a single culprit, really this is a multifactorial issue. Um, you know, the phones are certainly a contributor, but I think that like yes, there's a lot that's going on in terms of where kids are putting their attention. That's a problem. But I often think about, what are kids not doing
Yeah,
because
yeah,
they're on cell phones, right?
right. It's,
And so
yeah,
what we've seen along with the increase in cell phone use is the decrease in childhood independence, independent play, independent mobility, independent kind of adulting, right? The skills that you need to be, a functioning grown up come through play and exploration as a young person. Um, so, in addition to being concerned about what kids may be consuming when they're on their devices, I'm concerned about, basically the loss of opportunity for real world exposures. It's going to be more uncomfortable to be in a group of your peers when you're 15 and you're hanging out, in front of the coffee shop downtown because somebody's going to be a jerk or somebody's going to roll their eyes at you or someone's going to do something but you have to pivot and you have to be able to learn to be responsive. It's so much less anxiety provoking to be in your room by yourself, scrolling on TikTok. So I think that that's basically like the lack of socialization, the lack of being able to be independent, unstructured, and to navigate normal human experience is, I think, where a big part of this anxiety comes from. And your coping strategy ends up being isolation and, like an attentional dump into your device. So I
yeah,
think that it's not just like the phones are causing anxiety.
yeah.
I think that it's often like, what are the phones replacing? And, for some kids, particularly like for kids on the LGBTQ, who identify as LGBTQ, or for kids from, marginalized identities, the ability to connect with others in the way that social media allows can be a real game changer. So this is not to just demonize these technologies entirely. Um, one of my colleagues, Jill Walsh, who does a lot of work in this space, has said, if you're worried about your kid off of the phone, then you should be worried about your kid on the phone.
Mhm.
So if you have a kid who's already struggling or maybe feels prone to struggles with anxiety or depression, I would be even more cautious about giving access to a phone, because I think they're more likely to
Retreat.
retreat. Yes.
Yeah.
Yes. And also, you as a parent are going to feel more like a monster when you try to put limits around the device, which you need to do when
Yeah.
you know that your kid is struggling in other areas. So it's a real challenge. I mean, we're all still navigating this. This is, a new frontier in humanity. Um, but I think particularly for families who are concerned about child anxiety, it's another reason to be cautious for sure.
Well, I like that. The nuance of it is not just the phones, but that the phones are replacing other things, right? The
Exactly.
social abrasion that would happen through free play. I'm not saying children should, but the disappearing for long periods of time, and with your parents not there, and being bored and coming up with games or whatever it happens to be,
Right.
is important. I want to open it up to folks, that if we've got anyone that has a question that they would like Meredith to answer, I'd encourage you to pop it into the Q&A, or the chat, and we can get that, hopefully get your question answered. Um, when you think, Meredith, about parents, so I'm gonna move really back. You're becoming a new parent, right? And no one's really taught you how to do this. What is some advice in general? Just are there two or three or four things that if you were to say to folks, if you could just remember and try and do these things, it could help a lot? What would those things be?
So, my sort of North Star in parenting is the data that we see over and over again that one of the most stable protective factors that kids can have is a nurturing, stable relationship with at least one adult in their life.
Okay.
So, thinking about how there's been so much research that shows, when kids have been exposed to all sorts of god awful things, the kids who end up, in these longitudinal studies being able to sort of bounce back are typically the ones who had some sort of a steady attachment figure, not necessarily even a parent, right? But this doesn't mean an attachment figure who always made organic everything, or who had Pinterest worthy birthday parties, or who put them in all the activities. Like, just you being there and loving them
Hmm.
is, that's the core. I think everything else is what we're putting on ourselves in our culture of intensive parenting. Um, and frankly, what we're seeing, you can really think about parenting as sort of a U-shaped, like an upside down U-shaped curve, where either, too much involvement or too little involvement is bad for kids. But
Yes.
it's sort of what you're looking for is that middle. So it's this moderate amount of involvement, this moderate amount of kind of attentiveness. You don't need to be everywhere all the time, and curating your child's emotional experience and structuring their future. In fact, we see that can backfire spectacularly for many kids and many parents. So, I hate to be trite and just be like, don't try so hard, but don't try so hard.
Well, I hear you, and at the same time, it can be anxiety provoking as a parent to be wondering, am I doing all of the things that I should be doing
Yeah.
to help my child have an advantage in life and give them
Yeah.
an opportunity and
Yeah.
everything else? And the notion that you can actually do too much for them and that will, in and of itself, prevent them from getting where you might want them to get to, or they would, blossom, is an interesting thing. I know you've got a book coming out, I think in January, is that right? So tell us about this book.
Yeah, no, thanks for mentioning it. It's been a different a different type of project, but yeah, in January of next year, the book is called Parenting Anxiety. Um, Subtitle. Ooh. breaking the cycle of worry and raising resilient kids. I
Mhm.
really should know this, Maura, but
You get a few more.
again, it's sort of like as it's a little bit of a double entendre, right? Of both the anxiety that we feel as parents, so um, and parenting anxiety, but also how we parent anxious kids. So parenting anxiety. And so, the goal of the book was really to do a deep dive into the relationship between anxiety in parents and kids. As I wrote it, I became more and more interested in how our modern parenting culture is shaping our experience of parenting. And it's in a deeply intensive parenting is like a deeply anxiety riven construct, as you were saying, like I need to make sure I'm giving my kid all the assets and opportunities, and the emotional structures and the financial resources to be able to be what they're going to be in a world that feels increasingly uncertain, right? There's so much anxiety here, and all of this too muchness is actually eroding childhood independence. It's eroding their mental health, and it's not great for parents either, right?
Okay, yeah. It's
So, I think many of us would be willing to sort of like sacrifice ourselves on the altar of gentle parenting if it meant that our kids would be set for life, but that's just not what the data are showing. And so, the book is really like, what is everything that I as a clinician and my team, at the hospital, like what's everything we want parents to know about anxiety in kids so that you can support your kid and support yourself when anxiety, whether it's clinical or subclinical, inevitably comes up. So I'm excited about it. I hope that it'll be, useful for folks.
Oh, I imagine that it will be very useful and lots of people can use this. Well, we're at our time, Meredith, and I just want to thank you so much for talking with us tonight and
Mhm.
folks who are with us, that you were able to make some time and thanks for your patience in helping us get through our glitch here in the beginning. And
No
we
problem at all. I think you'll probably have a very sympathetic audience as well. I mean, who hasn't dealt with Zoom-based issues at some point in the last 5 years,
Right?
right?
Yeah. Well, we are recording this, so we're going to send it on to folks, and we're going to put it up on our website. So if there's someone that you think this might be useful for, there are ways to access this later. And for all of you out there who are dealing with anxious kiddos, whether your own or because you're an educator, I hope this has provided some help a little bit. And Meredith, I have a suspicion that at some point down the future we'll be chatting again about this very topic.
I'd love to. It's timeless. So
Unfortunately, right? Yeah. All right. Well, thanks so much, everyone. Good night, and thanks for being with us.
good
Bye-bye.
night. Thanks so much. Bye.